Hello everyone, welcome back to my channel. It's your girl KK Leto, aka KK. This is the channel named Bophelo with KK, Live with KK. Thank you so much for the subscriptions that I keep on coming, and thank you so much for the comments and the thumbs up that you are putting. I really appreciate your support. I'm sorry for the voice. I've been having a cold and my voice was totally gone, and today I thought, no, since I can talk now, let me just do something, because it has been a while since I posted. So I thought, let me just do something and post it today and share with my viewers what I have today. So today I'm going to talk about the care systems in the United Kingdom. We have 3 care systems, that is NHS system, private, and the care homes. That is what I'm going to talk about today. So please stay tuned, subscribe if you haven't subscribed, and share this video to your loved ones so that they can also get to know. Probably they are preparing to relocate to this side as professionals, and they are wondering, professional nurses and those that are, in fact, they are considering to relocate to join the care system in the United Kingdom, and they would want to know where to go, whether NHS, care homes, or private. So stay tuned. There are 3 healthcare systems: the NHS, care homes, and the private. I'm just going to give you information. I'll only talk about the 2 care homes and the NHS. I'll just give you the information, the benefits on each and the cons on each, then you decide which one is best for you. The NHS, it is the National Health Care System Service. National Health Care Service. Yeah, NHS, National Health Care Service. Yes, so this one is funded by the government. It's fully funded by the government, and every citizen and every resident in the United Kingdom can access the services for free. Yes, for NHS you don't have to pay anything. It's fully funded by the government. So the NHS controls the whole health system. It sets the standards of practice. It sets the standards of practice in the United Kingdom for all the healthcare systems, because what the government wants is that it should have the uniform or good standards of healthcare. Remember, United Kingdom is one of the best healthcare providers. So the government wants like the healthcare to be the best in all the systems. So NHS sets the standards that these other systems should try to follow. So in the NHS, the practice is standardized and evidence-based. Standardized and evidence-based. So much that when you go to the other hospital, you find that the practices there are the same with where you are coming from, because the whole system of NHS, the practices are standardized. And also NHS, it makes sure that the skills of people working there are developed, because when you want good practices, when you want good practice, and when you want best standards and that are evidence-based, every time the research comes out and there's evidence that this works, it means the staff has to be trained. So the NHS staff have the best skills. Because of this standardization, even the universities have to align themselves with the NHS so that they get the standards that NHS have set. Because if the government is training some students to come and practice in the NHS, they have to practice the NHS way. Yeah, They have to practice in a way that NHS practices, like the standards that NHS has set. So because of that, there are some courses that if you want to advance, you cannot just be admitted at the universities. You have to go through the NHS. Some courses, I remember I was looking for some courses I wanted to go to school to do something. Some things that I wanted, I realized that I needed to be working at the NHS for me to be able to be accepted in the universities. So NHS also controls the universities. So people that are working at the NHS are more advantageous when it comes to to going to the universities and to further their studies. So now, because of this standardized practice and the NHS serving the whole nation without people having to pay, the work pressure in the NHS is medium to high. At the start, it can be overwhelming, but with time, people get to adjust, get to, when you now have the skills and you get to see how people survive, things become easier, but still the pressure is still medium to high. So now we'll talk about the benefits of working at the NHS. Maternity pay is full for the first 6 months. Then after that, there'll be government pay, yes. And then there's also childcare leave up to 15 days over the term. 15 days of childcare over the term. Sick leave is full pay for 6 months. Overtime, maximum is 48 hours a week. And then there's hourly wage, or the salary ranges from $12.50 per hour. So that's $12.50 per hour. Then you also get discounts from some retailers. Yes, you can also get some discounts from the retailers. No flexible shifts. If we are told this is how the rota goes, it should go that way. It's not always to do the second job. Sorry, I had to check my notes so that I don't miss some things. It's not always to do some second job. Is there if the workload is from medium to high, it means you'll always be exhausted. But it's not always the case. It depends on the department that you are working, and days differ. So you can probably, some people still take extra shifts. It can be tiring because there's more to do, and we are serving the whole nation, and you have to strive to do the good standards and the good practices, and it's just a lot. So NHS workers are seen to have more burnout than other healthcare systems. So that's all for the NHS. Now we'll move on to the care homes. So at the care homes, they are not state-owned institutions. They are run by private entities. But like I said, they are guided by the NHS, isn't it? Like I said, the standards. The government wants all the healthcare providers to follow the standards that will give the good healthcare or the proper healthcare to everyone living in the United Kingdom. So with the care homes, you find that they follow the standards, but the practice is different, so much that from the other care home, going to the other care home, you find totally different place. The way they do things is different. Like their routine, the system they use is different. The medication, the way they give medications, it's different. Like the times they are giving medications are different, or the computer systems they are using are different. But with NHS, you find it's the same, but with the care homes, it's different. Each company or each institution runs its own things. There's work-based training and assessment. They have to be there because the NHS or the governing bodies that ensures that the healthcare providers have the skills required. They usually come and check that the trainings have been done and the assessments have been done. So here the trainings are done, like they are done by the care home. The care home is the one that arranges for the trainings to be done. So you find that it's not easy to advance when you are at the care home, because private, like it's not private as such, but these institutions have to fund every training, so it will be too expensive for them to take their workers for school. Yeah, that's the advancement for school. But as for the indoor trainings, they do the indoor trainings just so that people can keep up with skills, and so that they can pass the skills assessment. And also the work pressure here is medium to low, but be mindful that the care home, it's caring for the frail and the elderly. It's not like hands-on where you go do the switchers and emergencies and theater, but it's hands-on, like you be giving food, assisting people to eat, giving medications and assisting them to take medications, taking care of those with dementia. It's like, it's more hands-on. Yes, like it's more hands-on. There's more manual handling, and the nurse to clients ratio here is high. Client patient ratio is high. Find that one nurse will be taking care of minimum 12 residents, 15, 20, can go up to 56, 60 residents alone. You are the only nurse giving the medications from first resident to the last resident. You are just with the carers who are just assisting with daily care, providing daily care needs. But the clinical things, you are the one who's doing, though it's not much to be done, but it's a lot of people to take care of. So what are the benefits of being at the care home? There is high salary pay that starts from £15 per hour upwards. Now with the salary increase this year, it has really gone up. Like, people are getting more money at the care homes. There's flexible shifts and rota adjustments. It's easy to do that here at the care home. Overtime can be up to 60 hours per week. Annual leave, it's up to 5 weeks in stretch, but it depends with the employers. Like I said, it depends from the other entity to the other entity, the other institution to the other institution. So don't be surprised when probably your employer says you can't take 3 weeks at a stretch, but some can go up to 5 weeks at the stretch. You can also do the second job up to 20 hours per week, meaning on top of the, like, if that 60 hours per week that you can do as overtime at the care homes, you can also have another job where you can do up to 20 hours per week. Probably you register with the agencies to do extra job there. And also the relationship, nurse-client relationship or nurse-resident relationship is good, because you take care of the same people over and over again. Like, for a long time you're still taking care of the same people, unlike at the hospital where people just come and go, so there's no that relationship. So here you are able to know individuals fully. Like, you build relationships so much that you get hurt if one gets hurt. If you lose one, you also get hurt, because they become part of you. You become part of them, like you become like family. So The disadvantages of the care homes. Nothing is always good. There are always some cons. There's no child care leave. Maternity leave, you only get government pay. The care home doesn't pay you. At the care home, you get paid for what you worked. There is no sick leave. So no work, no pay at the care homes. So this is all I have for you. With what I have, you can decide which place is best for you, whether the care home or the NHS. It's up to you to decide, looking at your needs. Thank you so much for subscribing. Thank you so much for listening, and I hope this was informative. And if you found it informative, please remember to click on the subscription button if you have not subscribed, and if you have subscribed, please click on the like, on the thumbs up button, and you can also click on the bell so that we get notified